How does one become the most quantified man in Finland? Well, for me, I think it started right after I was born. You may have heard about scoring of newborns that started back in 1952 when Dr. Virginia Apgar in the US developed a numerical scale from 0 to 10 to evaluate the health of newborns. Maybe you remember your own score. Mine was not that good. As a matter of fact, it was so low that I received an emergency baptism in case I'd die in my parents' arms. Well, I'm a bit older now, and I have made it this far. Since birth, we are being measured in countless ways. It sometimes feels that in our society, life is a game of gathering points of various sorts, constantly leveling up until we die. And, of course, we accumulate data such as the medical cause of death as well. So, what I think should be examined first is what type of measurement and scoring is useful. The first memory that I have regarding the measurement was when I discovered my dad's orienteering compass. I was mesmerized by it. I was trying to figure it out. No matter how much I turned it or twisted it around, somehow the darn thing always knew where the north was. Then, a little bit later, when I entered my military service, I discovered that for a compass to be of any use, something else is needed. One's location, and preferably a map. For what good it is to start to measure something if you do not know what the data is all about? Later on, my studies in engineering helped me to see that besides the measurement device, the right context, trust in the measurement's accuracy is also very important. Maybe measurement was not as straightforward as I thought it was. Maybe someone's black is another one's white and vice versa. Could these principles to be applied in measuring life? And is that something that one should even aim for? Who would want to measure or assess one's life? I think we are already consciously or subconsciously measuring ourselves. We are constantly exposed to the mass media and social media. Our culture tries to set our expectations for happy, healthy, and productive life. But such a life is, in fact, out of anyone's reach. The pursuit of happiness makes us actually more miserable than happy. Are we, as individuals, chasing the ghosts of happiness, and should that be changed? Well, I think the change has already started. First, the same Western culture that urges us to pursue happiness is also encouraging us to work and produce more. Second, this demand for better productivity and creativity has an interesting side effect. There is solid evidence that when asked, the happier or more content a person is, the more productive and creative he or she is. So the pursuit of happiness is not futile in terms of society at least. And this is a message that resonates well with business executives and politicians. Which top decision maker would not be interested in producing more, gaining more wealth, or in the case of politicians, more taxes? For this very reason, workplace well-being is a growing trend. More is no longer such an accepted mantra anymore. Instead, the millennials are more interested in a workplace that cares about their well-being, accepts diversity, and is ethical. So, in this regard, measurement can lead us to think way beyond our careers and to figure out what it is that we want from life. So, can health tracking make you a happier or better person? As the most quantified man in Finland, I think I can offer you an answer. I've been measuring my health and well-being with dozens of devices over several years. So, what good has it done for me? There is emerging evidence that when one buys a device or tracker, the reason for that is not self-improvement, but rather a concern about something, such as health condition, physical appearance, self-esteem, and so on. So at this point, one starts to question that is this worthwhile at all? Meticulous health tracking can be very straining and time-consuming. Let me give you an example. I wanted to see whether or not it is possible to lose fat while maintaining muscle at the same time. That is, to have a leaner physique. For 1 month, I weighed all my meals, snacks, beverages, and even beers, although it was sometimes a little bit difficult to remember how many I have had. I now think that instead of paying so much attention to what we can measure and how we should do that, we should look behind this and start to understand what it is that causes us to worry in the first place. Besides self-tracking, I meet and coach people for both as my profession and for helping the ones who are the closest to me. The question that I most often get is, what type of device or tracker should I buy? My answer, what do you want to do with it? I usually get a puzzled look, but very soon the person is very happy with the discussion that follows. It is about their personal values and their idea of happiness and the pursuit thereof. I think that we are now in a point that we have produced enough, that we are in a society that produces surplus of goods and services way beyond our needs. So instead of paying so much attention to producing and creating more, we should start to measure ourselves in terms of happiness. To facilitate such a discussion, I usually start about asking about basic well-being. Are you well rested? Have you had enough sleep? If so, what is the quality of sleep? And now we are getting down to the real issue. What is affecting your sleep and lack of it? Similarly, the questions about eating and exercise follow. How important do you think what you eat and when you should eat? How do you feel when you eat? What is the nutritional quality and quantity of your meals? Do you exercise? How often? How long? What type of exercise is best and how much of it is enough? Bombarded with such questions, people usually go into the defensive. Well, I have to work for long hours because I need to take my children to hobbies and my spouse is traveling so much that I have so little time for taking care of myself. So now we are getting to the point. In a society that produces surplus of goods and services, we might have finally room to start to think what it is that we value the most in life. So in this regard, health tracking can be a very useful starting point to start to think of our values. We are already taking first steps in measuring emotions. Besides psychological profiling, we have taken our first steps for tracking physiological reactions in various social contexts, such as heart rate, blood pressure, respiration, and breathing rate. Furthermore, we have also harnessed artificial intelligence in recognizing emotion from our voice and facial expressions. I have actually tried this myself. I managed to capture my reaction to my own wedding. The most exciting or stressful event of the day was not the actual ceremony, but the argument that I had with my wife over the urgency of taking new pictures for her passport and driver's license. Continuing with the other example, we tried the exact same ring to measure a series of blind dates and the reactions on those blind dates. Was the ring able to catch the most likable romantic matches. It sure did. We also studied, could we discover with the help of machine learning, what is the most likable love song in Finland? With that study, we recorded test subjects' facial expressions when they heard the love songs. With that analysis, we were able to pick out the clear winner too. Merging the knowledge that we have accumulated over the past 100 years about psychological profiling, physiological reactions in various social contexts, analysis of our speech and images related to emotions, we can indeed say that we can grasp the whole spectrum of human happiness and well-being, besides health tracking as well. So, can health tracking make you a happier person? Certainly not, but it can trigger your inner compass to show what you value the most. Thank you.